Everyone, welcome to another episode of Physiopedia. Today we'll discuss a very trending topic in India, that is GBS. You must have heard of this word all over the newspaper and all the social medias that GBS has suddenly rise in India, especially in Pune, Maharashtra. So before we get panic of this condition, I think we should check the facts regarding this condition, what are the reality and how threatening it is in real world. So firstly, what is GBS? GBS is acute inflammatory autoimmune demyelinating polyneuropathy. So it happens suddenly. It is not like you are infected with infection today and you will get it after one month. No, it will show results in 1 to 3 days. So what are the sources of this condition? These are some virus and bacteria like Campylobacter jejuni, Epstein-Barr virus. Post-vaccination, all these things can trigger an autoimmune response in the body. These bacteria and viruses are commonly found in the raw meat and raw milk type of food. So we have to be clear with what type of food we eat. Infection in GBS triggers autoimmune response in the body, which indirectly affects your nervous system, especially the peripheral nervous system, myelin sheath and axonal part of the neuron. Hello everyone, welcome to another episode of Physiopedia. Today we will discuss about a condition named as Guillain-Barre syndrome. Recently, you must have heard of this name in newspaper and news channels everywhere, as the cases of this condition has suddenly increased in India, in Maharashtra. This condition is nothing new for neurology, but it has created a panic stage in the current scenario in India as if it is contagious. So before we come to any conclusion, let's check the facts related to Guillain-Barre syndrome. First of all, what is Guillain-Barre syndrome? It is an acute inflammatory demyelinating polyneuropathy. That means the condition will be acute. It won't be like today I am in contact with a bacteria or virus and I may see the signs and symptoms after 4-5 months. No, it may show the signs symptoms immediately from the contact in 2 to 3 days max to max. Inflammatory, because it is caused after any infection has reached our body and it has resulted in an inflammatory situation. This inflammatory situation triggers an immune response. This immune response ultimately becomes harmful for our own body cells, that is autoimmunity condition. In this condition, these cells of our own body which were supposed to protect us becomes harmful for us and leads to damaging our own cells. In this GBS, the damage happens mostly to the nerve cells, the part of the nerve or the neurons that we have already discussed in our last few videos. Third point, it is demyelinating. That is the covering over the neuron, over the axon of the neuron, that is made up of myelin sheath. That myelin sheath is attacked in this condition mostly. And polyneuropathy, it will not involve single nerve, it will involve more than 2 to 3 nerves of our body, or in some cases quadriparesis, that is all the 4 limbs, nerves of the whole body can also be involved. So basically it is an inflammatory autoimmune condition, demyelinating polyneuropathy, and it is acute in nature. Now, what causes this condition? You must have heard this first word, that is Campylobacter jejuni. You must have read that most common is Campylobacter jejuni, Epstein-Barr virus. Yes, it is common. Other than that, influenza virus, influenza vaccination, they also have the capability to trigger this immune response which is responsible for GBS. Now, how can we get in contact with these viruses? As it is a time of cold, we all know we go through influenza-like virus infection. So that in some people who have weak immunity can get affected by Guillain-Barre syndrome if their immunity is weak. Secondly, and interestingly, gastrointestinal system has been found to be associated with this condition. That is, in gastrointestinal system, there are some bacteria that cannot fight some bacteria, and as a result, patient may feel the symptoms of diarrhea for a few days. Your body wants to protect you from that virus and bacteria, but it cannot. Ultimately, this gastrointestinal tract gets infected and leads to an inflammatory situation. In fight between that antigen and antibody, our body starts to produce antibodies, and this antibody after certain time acts as the antigen and triggers an autoimmune response which damages our own body cells. Now, another third important point is post-vaccination. This has been found based on evidence that influenza vaccination which is being given can trigger this autoimmune response which can lead to GBS. These are all evidence-based causes. So, who are at the risk of this condition? Kids, children, older age group. It has been found people with less immunity are usually children's and elder age group more than 50 years of age. So these groups of people should be careful for GBS and must check their signs and symptoms. Now, among male and female, males have been found to be more affected with GBS than females. Let's see more. Clinical features of GBS can vary according to the attack happened to the nerve. If, as we all know, nerve consists of sensory, motor and mixed type of tract. So, if the attack happens only to the motor nerve, only to the motor segment of the nerve, then it gives you the presentation of Aman type of Guillain-Barre syndrome. If it involves sensory and motor both features, then it can involve Asman type of GBS presentation. And if it is AIDP, that is acute inflammatory, triggers an autoimmune response which damages our own body cells. Now, another third important point is post-vaccination. This has been found based on evidence that influenza vaccination which is being given can trigger this autoimmune response which can lead to GBS. These are all evidence-based causes. So, who are at the risk of this condition? Kids, children, older age group. It has been found people with less immunity are usually children's and elder age group more than 50 years of age. So these groups of people should be careful for GBS and must check their signs and symptoms. Now, among male and female, males have been found to be more affected with GBS than females. Let's see more. Clinical features of GBS can vary according to the attack happened to the nerve. If, as we all know, nerve consists of sensory, motor and mixed type of tract. So, if the attack happens only to the motor nerve, only to the motor segment of the nerve, then it gives you the presentation of Aman type of Guillain-Barre syndrome. If it involves sensory and motor both features, then it can involve Asman type of GBS presentation. And if it is AIDP, that is acute inflammatory demyelinating polyneuropathy, in this case only the myelin sheath of the nerve is involved, not the axon. Unlike Aman and Asman, axon damage is more, but in AIDP demyelination is more. Next to that, what can we expect as the symptoms or the features of GBS? Number 1, sensory, motor and autonomic features, that is tingling sensation, numbness and all these features of sensory. Motor, there can be the weakness of, as it is peripheral nerve, so there we can see the weakness of the muscle or paralysis, as well as we can also sometimes in severe cases see flaccidity. Autonomic features can be involved, as we all know that nerves also carries the autonomic sensation and autonomic part are also there. So autonomic features can also be seen on the skin and on the internal vital organs. Next is ascending type of polyneuropathy and gloves and socks pattern. This is a typical feature of GBS. In GBS, the damage starts from periphery and reaches the center. That means the damage will start from my foot or my hand and it will ascend to forearm, arm, likewise. And in lower limb, foot, knee and hip. So gradually it will ascend the body, the damage. That is, the person may feel tingling or numbness in the hands. Later on they may complain that it is ascending. That's why it is known as gloves and socks pattern. So what can be done? Keep a check of your symptoms, signs and symptoms. If you feel that you have been through cold and cough and it is not resolving, get a check, get a consultation from the doctor and check your symptoms. And if the condition is severe, then medical management for IVIG includes intravenous immunoglobulin injections. This shows very quick recovery from the damage happened due to that autoimmune trigger response. Next to that, once this autoimmune trigger was subsided, then supportive care for the other damage that has been caused due to GBS can be taken care of. Ventilation has actually created a panic among the people that people may get ventilated in GBS. Actually, it is necessary only when it has ascended up higher than your chest level, when your breathing becomes difficult. But in the window of 1 to 2 hours, if the patient is taken to hospital and the necessary immunoglobulins has been injected, the chances of ventilation reduces. So window plays a window to take the person to hospital, and starting of medical management plays a major role in preventing the residual damage. Next and most important is physiotherapy. As we know that after the damage has happened, muscles has been affected, movement has been affected. We need some movement and other guidance later on, and we need thorough exercise to come back to our life. So proper physiotherapy treatment after GBS can prevent the residual damage and can help the patient to come back to normal life as quickly as possible. So what can be done to prevent this? We have to eat healthy to boost our immunity. The more your immunity is boosted up, your chances of getting affected with this is less. Exercise regularly and consult doctor on time. Along with that, with eat healthy, I also mean that try to avoid eating food from the areas which can be contaminated with those virus which has been mentioned in the previous slide. So stay healthy, stay happy. Okay, thank you. So that's all regarding GBS facts and checks. If you still have any doubt, you are welcome in comment section with your questions. Thank you.